Angelicus and Equations here. Sperb.
Welcome everybody to episode 38 of Sperb's Herbs. Today we are going to be talking about a really important formula, Xiao Chai Hu Tang, or minor Bupleurum Decoction. This is one of our oldest formulas, and yet one of our most important when we start talking about modern day diseases. Just an incredibly important formula. And so without further ado, well, there will be a little further ado, but let's get into it. All right, so today's episode, as I said, we will be looking at one of the most important versatile formulas in Chinese medicine, Xiao Chai Hu Tang, a minor Bupleurum decoction. This formula, more than most, is surprisingly useful for a wide variety of modern conditions. Join us as we look at this versatile and amazing formula, as well as exploring something a little different, where we continue our exploration of Pao-zhi, or herbal processing. But before we do that, I have a couple questions for you. Have you ever wanted to give herbs to a patient on drugs? Do you have the knowledge and tools to do that effectively and safely? I am finishing up my drug herb webinar series, which, if you don't know, is from my textbook I have written, which gives this webinar series gives you real-world tools to answer these questions. As a beginning, the first course will give you an in-depth overview of how drugs, and by the same token, how herbs work on the body. The second episode, or the second webinar, focuses on drug-herb interactions and gives you a unique, powerful, real-world tool for assessing them. This knowledge should be in every practitioner's toolkit, so I'm going to give you these first two courses, 6 hours of CEUs, for 30% off the regular, already low price. Just go to integrativemedicinecouncil.org/32 and get your discount right now. But hurry, this is, as they say, a limited time offer. All right, let's get into our episode today. We have a lot. This is one of my longer episodes, so it's going to be a good one. So in our last couple of episodes, we have talked about Pao-zhi, or herb processing, and specifically shui-zhi, water processing, and huo-zhi, fire processing. Today we'll be looking at how fire and water is used in processing herbs, and finish up our discussion with processing using fermentation, germination, as well as other processes. This is all based on CNU's wonderful book, An Introduction to the Use of Processed Chinese Medicinals. So water and fire processing. By combining fire and water, several different and commonly used methods of herb processing are created. The first of these is zheng fa, or steaming. This is where herbs are cooked in steam, or pressure cooked is considered steaming method as well. This method is used to modify a nature or action, lessen a drastic action or side effect, and or facilitate preservation, cutting, and storage. Another method is zhu fa, or preparing or boiling. This is where the medicinals are boiled in water or in a decoction. This method can reinforce an action and or lessen toxicity of the herb. Sometimes vinegar water is used in this process. Vinegar, with its acidity, really does change the process and can cause chemical reactions in the herbs being processed. Dan fa, scalding, is where medicinals are plunged into boiling water, stopping the boiling and removed as soon as it starts a new boil. So you put the herbs in, the boiling stops, and as it comes back into a boil, you take the herbs out. This can eliminate non-medicinal parts or facilitate drying and preservation. Sui fa, or dip calcining, is where the medicinal is heated until red hot and then dipped into a liquid of water or vinegar and then repeated several times. This is used for minerals, shells, scales, and carapaces. Like turtle carapace, the shell of the turtle. It renders the medicinal friable, which means breakable, to facilitate pulverization, so to help powder it or break it into smaller pieces. The last of water and fire processes is Zhonglu, or distilling. This is where specific aromatic plants are distilled slowly in steam to capture their essential oils. Now we move on to fermentation and germination. So we have fa jiao fa, which is the Chinese term for fermentation. And this is where medicinals are left in 30 to 37% humidity until they ferment, so they grow a fungus, or not really a fungus necessarily, but bacteria or something along those lines. That's fermentation. Fermentation is the breakdown of sugars in the natural substances by bacteria, and that's what technically fermentation is. And essentially this transforms the nature of the medicinal and confers new actions and indications on that particular herb. We also have fa ya fa, or germination, and this is where grains or seeds of plants are maintained at certain temperatures and humidity to cause germination to start to sprout. This accomplishes similar goals to fermentation. It transforms the nature of the medicinal and confers new actions and indications. So there's a question here, because we had a Sperb Herbs episode on garlic daswan where I talked about black garlic and how to make black garlic. It's a really fascinating ingredient. I still haven't used it. I'm dying to use it. And it's made by being kept warm for weeks. And so the question here is, does this lead to this type of fermentation? And the question is the humidity that is occurring in. I think black garlic isn't exactly this type of fermentation. Garlic itself, it's very difficult for bacteria to grow on, so it's unlikely that it would have a natural fermentation process. The black garlic is sort of I think what that is an inherent breakdown of some of the products that are actually in garlic, and so that causes the black garlic. So I don't think it's this type of fermentation, but I'm not an expert on it, but I don't think it is. I think it's something a little bit different. So great question though. So other processes here, we have, what we've discussed this episode and over the last few are the most common processes herbs undergo. There are many other methods used to process herbs and medicinal substances. Often these are complex and are only used to process one or two herbs. Example include the complex methods of preparing ban sha, Pinellia terminate, which we're going to talk about today. We're going to be using ban sha, or prepared Pinellia terminate, or simply adding cinnabar powder to certain herbs. Again, probably not used much in the United States. Cinnabar is mercury powder. It's an alloy of mercury, so it's not, cinnabar powder isn't commonly used in the United States, and it should not be on any of the herbs we get imported, but that is a traditional methodology for processing herbs. So this concludes our multi-episode introduction to herb processing. Of course, there is a lot more to herb processing, but the methods we have discussed are very commonly used in Chinese herbal medicine. It is important to have at least a basic understanding of these methods, as they can dramatically change the safety and use of medicinals. And with this, you know what I'm going to do is another form coming up, maybe not next episode, but coming up in the near future. I'm going to do an episode on granules and just talk about how they're prepared, which is a whole nother preparation of herbs, and yet probably the most commonly used form today among professionals is the use of granules. So we'll talk about what they are and how we make them and some of the issues with them. There's a great little book that a friend of mine wrote, Eric Brand, on granules, understanding granule herbs. And so I'm not sure that's the exact name, but it's basically what it's about. And so we'll get into that as we go along. So really interesting. So we'll talk about that in the future. But for now, with all of this under our belt, let's talk about today's formula, Xiao Chai Hu Tang. So this formula is in the subcategory of formulas that harmonize lesser yang warp disorders. So that's the subcategory. We're going to talk about what this lesser yang warp, it's an interesting translation, but we'll talk about what it means in just a second. So it's harmonized lesser yang warp disorders, and that's all under the broader category, the chapter in the book of formulas that harmonize category. This is a super interesting category of herbs, because I tend to think, for me personally, that acupuncture is very harmonized and very regulatory. Like the body will take what it needs to take from acupuncture in general. There's some exceptions to that, but herbs to me are what I call very pushy. It's like the herbs are going to push you in a direction, and so if you get herbs wrong, you can do some harm. If you do acupuncture a little bit off, I don't mean placement. Sometimes that can cause some harm if there's a mistake in the placement. But if you put in a point that's not exactly great for that patient, it won't cause harm in general. But herbs can if you put in the wrong herb. But this harmonized category is more in this regulatory mode. It's like the body takes from these harmonizing formulas and does what the body needs to do with it. So they're really interesting. And because of this sort of harmonizing and regulatory function, they're very widely used. We already talked about one of them, Xiao in an earlier episode, which is an incredibly popular formula. Xiao Chai Hu Tang is an incredibly popular formula. There's a couple others we'll get into, I'm sure, as we go along with Sperb herbs. But these are really important clinically, these formulas, these harmonizing formulas. And so, so I said this is in the harmonized lesser yang warp disorders subcategory according to Scheid and his team. Chen and Chen actually very similarly say it is a Xiao-Yang harmonizing formula. So Xiao-Yang is the actual Chinese word that we use, and often I've heard it translated as lesser yang, but here in Scheid they're saying it is, they're translating it as lesser yang warp, while Chen Chen doesn't translate it at all. It just says Xiao-Yang. So, but they both agree that it's very harmonizing. It's all same category with all the authors. Other names for this formula include Bupleurum Decoction or Chai Hu Tang, so forget the Xiao. Yellow Dragon Decoction or Huanglong Tang. Three Prohibitions Decoction, Sanjin Tang. Ginseng Decoction, Renshen Tang. Harmonizing and Resolving Powder, He Jie San. Or just minor bupleurum combination rather than decoction. So in order to discuss this formula, we do need to discuss a uniquely Chinese medical diagnosis called Xiao-Yang or lesser yang disease. So this is part of a diagnostic approach called the 6 stages or Liao Jing. This was first written in the 3rd century CE by Zhang Jing in his foundational book, Shanghan Lung, or Discussion of Cold-Induced Diseases. So if you're not familiar with this book, it's a foundational book. It is the first existing book on Chinese formulas. So if a formula is in this book is very widely studied. I have one of my mentors, this was his entire doctoral program, was working with this book. Incredibly important, not quite 2,000 years old. First herbal book, still foundational today, very useful in Chinese medicine. And so a couple things. Zhang Jing is quite revered. This book, Shanghan Lung, was actually part of another book, and that book was kind of lost, but reconstituted a few centuries later into 2 different books. And so this is one of them, the Shanghan Lung. The other one we've also discussed many times, which is the Jingui Liao Feng, which is the cabinet, the formulas from the Golden Cabinet. And those 2 were one book. So, but this book, the Shanghan Lung, is about external diseases, how external diseases come into the body and go internal. And that's basically what the 6 stages describes. It describes how a cold pathogen enters the body, moves from the outside to the inside of the body with various signs and symptoms of the various stages of this progression. That is the Shanghan Lung, that's the 6 stages. The other part of the book, the Jingui, that is more about what we call miscellaneous diseases, but internal diseases, other diseases, not diseases that came in from the outside and will go inside. So what this book does is it really kind of establishes, and it came from the author's experiences. He says the very first is he lost I think 1/3 or 2/3 of his family due to an epidemic that went through. So he wrote this book with his wisdom to try and prevent that from happening. So this is all about how an epidemic happens and how you deal with it. Does that sound, when we're right here still in the middle of COVID-19, that becomes an interesting thing. Though COVID-19 might not fall under this cold-induced diseases. I tend to think of it as more of a Wenbing, or which is warm diseases, how a warm pathogen comes in. but still, you can see we're still dealing with this. We've always dealt with this as human beings. So the 6 stages follow the 6 pairings of the major acupuncture channels and roughly flow from exterior to interior. Gallbladder and triple burner are the paired Xiao-Yang channels. So those are the actual meridians that are Xiao-Yang. And so often you'll see with formulas, with acupuncture for Xiao-Yang disease, often gallbladder and Sanjiao or triple burner points are used. We've talked around triple burner quite a bit on these Sperb herbs. And so I think I'm going to skip that conversation. At some point, I need to have a deep dive into that so we start to get a better understanding of that. But it is an organ, according to Chinese medicine, and has no equivalent at all in biomedicine. So the Xiao-Yang stage is the third of the 6 stages, the last of the 3 exterior Yang stages. Yang is exterior, Yin is interior, and is considered the transition from an exterior to an interior condition. It's called the pivot. This is a really important thing. It's often said to be being half interior and half exterior. Half in, half out. Which makes this really important, because if we stop it here, we stop the seriousness of an internal condition. If we don't stop it here, we get into way more serious stuff as this pathogen goes in more deeply. So this is a really important point where we can still get at this without any major danger to the body. There's still maybe some consequences, but not life-threatening. As it goes internal, it becomes more and more life-threatening. And so really important point for us to deal with this pathogen as it's entering the body. So signs and symptoms of Xiao-Yang disease or Xiao-Yang Bing include alteration of shivers or cold feeling and fever or feeling of heat. And this is really important. This alternating fever and chills is incredibly important, is kind of the hallmark, the classic, the defining symptom of Xiao-Yang. You have to have this. If you don't have alternating chills and fever, then you're not quite at the Xiao-Yang. You're not at the Xiao-Yang stage. It's one of the other stages. So that's the important thing that we're looking for here. Other things that we see are bitter taste in the mouth, dry throat, blurred vision, hypochondrial fullness and distension. So hypochondrial means basically just below the rib cage is generally where the hypochondrial area is. So the upper part of what we call the stomach area. No desire to eat or drink, irritability, nausea, vomiting, unilateral thin white coating on the tongue. So that's interesting. Unilateral, one-sided thin white coating. That's an unusual little symptom. And we expect a wiry and fine or thready pulse in this thing. So again, we haven't gotten into a lot with pulse diagnosis yet, but pulse diagnosis, of course, is super important with diagnosis in Chinese medicine. I like to call it the MRI of Chinese medicine. I like to look at the tongue is another important part of diagnosis. That's why we talk about the white coating. We just talked about the white coating. I call that the CT scan of Chinese medicine. We can tell a lot about what's going on in the body by looking at the tongue and feeling the pulse. And I also, one of my things is facial diagnosis, looking at how the face looks and different colors and things. And so with those, you can tell a lot about what's going on with a person. So. And here's the thing about Xiao-Yang and why we're talking about the classic formula for treating this condition is today's formula, Xiao Chai Hu Tang. In fact, it's almost equivalent. You're Xiao-Yang, then we need you on, if you're on Xiao-Yang, which is SHAO, Xiao-Yang disease, then we need to use Xiao, XIAO, Xiao Chai Hu Tang to help treat that. Very important. Now, acupuncture can certainly help, but this is getting at that point where herbs are really important in order to prevent it from going internal. So the Chinese medical actions, according to Scheid and his team, is for this formula says harmonizes and releases lesser yang warp disorders. That's all. That's its entire medical action. So pretty darn straightforward. And Chen equally as straightforward. It says basically the same thing. Harmonizes Xiao-Yang. So there's not a lot of oomph there with these medical actions. Usually we have something that does this, and that, and it's a little bit more complicated. These are really straightforward. It does Xiao-Yang disease, basically. But when we get into the indications, which is now, we get into a lot more interesting sort of signs and symptoms and what this is useful for. So Chinese medical indications, according to Scheid, he and his team say this formula can be used for alternating fever and chills. As I mentioned, really important. Dry throat, we talked about bitter taste in the mouth, dizziness, irritability, sensation of fullness in the chest, and hypochondria, often experienced as difficulty in taking deep breaths. So if someone can't get a nice deep breath, that is indicative of this potentially indicative of this formula. Heartburn, nausea and vomiting, being downcast with no desire to eat, a thin white tongue coating. It doesn't talk about being unilateral in this. That's sort of a broad explanation of Xiaoyang. In this case, just thin white tongue coating and a wiry pulse. We talked about the wiry pulse earlier. There may also be palpitations, coughing, or urinary dysfunction. So they're having trouble. Something's going on with the urine. And Shenzhen have very similar, indications and manifestation. I didn't think we needed to go into it too much because they're very similar, not a whole bunch of difference. And this is pretty full already. So continuing, Scheid says this is a cold pathogen constraining the lesser yang warp. And again, that's a translation of Xiaoyang, and impeding its ability to direct the clear upward and the clear upward and the turbid downward. So this is a good thing. We generally want, when our body's working well, we send the clear up so that we create qi, and it's a good thing. And we send the turbid down where it gets a little processed and we excrete it, usually through urine. So it's important that we have this clear going up and this turbid going down. And if that is impeded, then that's an indication for this formula. The lesser yang defines the spaces in between the interior and exterior of the body. Its function is to direct the protective yang qi produced by the gate of vitality, or the Ming Men, and the clear fluids upward and outward, and the turbid fluids downward from the upper to the lower burner. So gate of vitality is a really important concept in Chinese medicine. It's considered where the fire of the body comes from, and I'm going to leave it at that. That's another deep dive at some point that we're gonna need to get into. So when a cold pathogen that has penetrated the exterior constrains the protective aspect, that's the outside. It constrains your ability to protect yourself, or wei qi. We have talked about wei qi before. Yang heat accumulates in the interior, so there's heat happening here. The ensuing struggle between the protective yang and the pathogenic cold is reflected most clearly in the symptom of alternating chills and fever. When the pathogenic qi prevails, failure of the yang qi to warm the exterior causes chills. At more or less regular intervals, the constrained yang qi discharges to the exterior, which is experienced as fever by the patient. However, because this discharge is disorderly, it fails to dislodge the pathogen. Constrained heat rising upward in the interior also causes a bitter taste in the mouth, dry throat, and dizziness. So those are the indications for this formula. Let's talk a little bit about its history. As mentioned, this formula was first described in the same book describing the 6 stages, which is the Shanghunlong, or Discussion of Cold-Induced Diseases, written in the 3rd century CE by Zhang Jing. It is the first existing book on herbal formulas, which I mentioned already. It is absolutely foundational to Chinese herbal medicine, and its formulas still play a very large role in modern herbal pharmacology. All right, let's get into the ingredients. It's not a huge formula, but each of the ingredients is super important. So let's talk about it. So the chief herb is Bupleurum Radix, or Chai Hu, and we use a big dose of this of 24 grams. That's a really large dose of Chai Hu in general. And it's from the cool acrid herbs that release the exterior. So already we're kind of seeing, first of all, it's cool. We said it's a cold pathogen, so that's an interesting little twist, but that this opens up the exterior. That's the idea behind Chai Hu. It's also quite a moving herb, so that could be useful as well. It is the most important herb for preventing pathogens in lesser yang warp disorder. This is in the textbook for herbs, not for this formula. It is bitter, cooling, and out-thrusting, making it perfect for constrained qi transformed into heat. It also spreads the liver qi with an ascending cooling action, contrary to most cooling herbs, which cause things to descend. So that's interesting. It sends things up rather than down. Scutellaria radix Huangqin, and we use 9 grams here, is from the clear heat and dry dampness category of herbs. So that's interesting. Clearing heat now, which is good. Remember we said there's some constrained heat here. So this is a deputy herb, which drains heat from the liver and gallbladder, the interior aspect of the lesser yang warp. It vents the pathogenic influence and thereby releases lesser yang warp disorders. And according to Bensky and his team, so this is single herb book. You know, Scheid is the formula book. Bensky is actually part of that et al. That team on Scheid. In fact, he wrote the first one or two versions of the formulas book, but then Scheid took over on the third version. So that's what it's there. So Bensky's involved in that book as well. And he says in this single herb book, this herb cools heat, dries dampness, stops bleeding, and quiets the fetus in pregnancy. It's a very useful herb. It's one of the 3 or 4 yellows, depending on what you include, and it's very important for draining damp heat. Our third herb is that herb I already mentioned we were going to see, which is Pinellia rhizoma preparatum, or Zhi Ban Sha. We talked about this in a complex preparation for using it. This is interesting. Scheid says 24 grams in the formula. That's a large dose of Ban Sha. Chen Chen says only 9 grams. So for me, this herb can be considered toxic, which is why it's so heavily prepared. I'd probably be a little bit more on the conservative side myself. But, and you'll see actually when we go to prepare it, Scheid says use a lesser amount. So use a lesser amount. And this is from warm herbs that transform cold phlegm category. So this is really useful if you have a lot of phlegm going on. Both in Chinese medicine, we talk about substantial phlegm and insubstantial phlegm, which are 2 totally different things. We're going to talk about that at some point. But this can be used for either of those, but often definitely for substantial phlegm that you're coughing up and things along those lines. So Scheid and his team say this is one of the assistants of this formula and warms and transforms phlegm and turbidity in the middle burner. And Bensky, the single herb, says this, Bensky and his team, says this herb is acrid or spicy for opening, slippery for directing rebellious qi downward, and bitter for drying. Best used for thin phlegm or dampness as well as rebellious stomach qi. So we can see in this case, if there's some phlegm, this is an incredibly useful herb, and there often is at this stage of the disease. So very useful. That sort of, we won't get into that yet. Okay, next herb. Zingiberis rhizoma recens, or Shenjiang. This is fresh ginger. We use 9 grams, which again is a totally normal dose for this, but we don't usually put it in grams. We usually put it in slices. So it's interesting that this actually has 9 grams, and both books agreed on that. So this is from warm, acrid herbs that release the exterior. So remember, our chief herb, Chai Hu, is a cool, acrid herb that releases the exterior. This is a warm, acrid herb. So we have a lot of cooling herbs. This just makes sure we don't overcool. That's sort of, in harmonizing formulas, we often see opposites. So we have warming and cooling. We have up and down, which we see in this formula. Chai Hu goes up, Huangqin goes down. We see all these different, we have inside, outside. We see that in this too. So really interesting. That kind of is a hallmark of harmonizing formula. So one of these says, this is also another assistant, along with Zhi Ban Sha, which we just mentioned. So together, they harmonize the middle burner, direct rebellious qi downward, and stop nausea and vomiting. We have ginseng radix, or ren shen. Hence, remember one of the alternative names for this is ren shen tang, so our ginseng decoction. So this does have ginseng, 9 grams, a fairly typical dose for it. And this is from the tonified qi herbs, or tonified qi category of herbs. So very useful for supporting qi. This and the last two ingredients are all assistants for the formula. So again, there's a lot of assistants in this formula. This is an assistant for the formula. Together, this and the next two ingredients that we talk about support the normal qi and thereby prevent the pathogenic influence from penetrating to the interior. So this is designed to kind of strengthen your qi that can help repel out the pathogen. This herb powerfully tonifies the primal qi of the 5 organs, nourishes the yin, revives from collapse, and stops heavy bleeding. So that's the traditional functions of this herb. And I know not all of you can see the pictures I have here, but it comes in a white variety and a red variety. I have pictures of both of those. And you can be more specific. So Baishen is white and Hongshen is red, ginseng. And they have slightly different properties. So depending on what you want, red tends to be a little bit warmer. White tends to be a little bit more nourishing of the fluids, that nourish yin sort of aspect. So depending on exactly what you're looking for, you might choose between red and white. And of course, there's tons of different qualities, and you could spend a lot of money on ginseng. Our next herb is another, probably our most commonly used herb, Glycericerae radix preparata, or Jurgansau. This is prepared licorice. Honey fried licorice generally. And 9 grams of it. That's a fairly high dose of this herb. Generally, we use it at slightly smaller doses. 4.5 grams is kind of a considered dose, a normal dose. 9 grams isn't out of the realm of normal. It's just a little bit higher than average. So, and again, this is from the tonified qi category of herbs, just like Renshen. Scheid and his team say, in addition to the already mentioned functions in this formula, Jurgansau and Dadzao, which is our next one we're going to talk about, also moderate the acrid, dry properties of Zhibansha and Shenjiang. So we said Zhibansha is warms and transforms phlegm, so that's a little bit warming. Shenjiang is in warm and release the exterior, so that's a little bit warming. So those are a little bit warming. What this is doing is moderating that spicy, dry properties of those two herbs. So it's harmonizing. That's a lot of what Jurgansau does and why it's so popular and probably the most commonly used herb in our formulas, is because in and of itself, it's a harmonizing herb that makes other ingredients less harsh. And we see that specifically here with these two herbs, Zhibansha and Shenjiang. And our last herb is Jujube fructus Dadzao, or Chinese dates. And in this case, they use 12 pieces. Now that's traditionally, though, more in modern times, 4 pieces are generally used. It's interesting. Chen just says 4 pieces, and Scheid and his team in the book says 12 pieces, but then has a little note below it saying that in modern times we generally use 4 pieces. And it's thought that the dates in the past were much smaller, so you would want more of it than modern day dates. So, and again, this herb is in the category of tonify the qi, but also this is commonly used to harmonize other herbs. In fact, sort of the 3 harmonizing herbs that we see a lot, I call them the 3 treasures. I think a lot of people call them the 3 treasures, though I don't know if that's a technical name, is this licorice, either prepared or unprepared, licorice, these Chinese dates, and Shenjiang, the fresh ginger. Those are commonly used. Now, the licorice is used more often than all 3 of them, but all 3 are frequently used in herbal formulas to kind of harmonize a formula. And it probably stems from Shanghun Lung and the use of these ingredients in that. So this is another assistant herb according to Scheid and his team, and the Shenjiang and Dadzao mildly regulates something here. So Shenjiang and Dadzao mildly regulates the nutritive and protective qi and assists Chai Hu in releasing the half exterior aspects of this condition. So that's all the ingredients. Now, how is this traditionally prepared? So standard preparation is to prepare this formula as a decoction. Scheid and his team say decoct the above ingredients in approximately 12 cups of water until 6 cups remain. The ingredients are removed and the strained decoction is further decocted until 3 cups remain. This is taken warm in 3 equal doses over the course of a day. So the doses here are daily doses, basically. They continue, Cotinopsis radix Dangshen is commonly substituted for Renshen at 2 to 3 times its dosage. So this is a common substitution. Dangshen has traditionally been much easier to obtain and much cheaper than ginseng. Though I gotta say, these days Dangshen is fairly expensive. In fact, if you're using 2 or 3 times the amount of Dangshen, you're probably a little bit more expensive than maybe not a great quality, but a decent quality ginseng. So you might want to consider just sticking with the ginseng. Ginseng is considered superior to Dangshen, but not greatly superior. So it's a perfectly common substitution to use Dangshen rather than Renshen. But I don't know if it makes a whole bunch of sense in modern day. Most practitioners also reduce the dosage of Chai Hu and Zhiban Cha to 12 grams. That I think seems appropriate. And Zhigan Cao to 6 grams. Again, I said 9 grams is a little bit on the high side, so 6 grams is about right. So I agree with those reductions. So that's preparation. Let's talk about commentary. This is where you kind of dive into it. There's a humongous commentary on this, several pages. Can't get into all of it with Scheid and his thing, but I did excerpt stuff that I thought was really interesting. But there is definitely a deeper dive in their book. So according to them, according to discussion of cold damage, that's Shang Han Lung, the common methods of treating externally contracted diseases are inducing sweating to release the exterior and purging or vomiting to expel interior accumulations. However, neither of these approaches is appropriate for treating a lesser yang disorder. The pathogenic influence is lodged too deeply in the interior to be released by sweating, which would only injure the fluids and the normal qi. Yet, the pathogen has not penetrated deep enough to justify purging, which would injure the yin and could lead to palpitations with anxiety. Because the symptom of chest fullness is due to qi constraint rather than pathogenic accumulation, inducing vomiting is also inappropriate. This would merely injure the yang of the chest and could lead to palpitations. The preferred method, which unblocks the qi dynamic to clear heat constraint, vents pathogens from the lesser yang, and harmonizes fluid metabolism, it is known as harmonization, or literally harmonizing resolution, or hejie. They continue to talk about this formula's wide range of applications. Quote, located in between the exterior and the interior and responsible for regulating the distribution of qi throughout the body, the lesser yang is referred to in Chapter 6 of Basic Questions. That's the Wang Di Ne Jing Basic Questions. So this is the first existing book on Chinese medicine, and is, I don't like the word Bible, but is considered foundational, very foundational text in Chinese medicine, the foundational text. So it's the yes yang is referred to in Basic Questions as functioning like a pivot or shoe. When the pivot becomes stuck, the qi dynamic breaks down. This gives Xiao Chai Hu Tang an extremely wide range of possible indications. The formula is mentioned over 20 times in discussion of cold damage and essentials from the Golden Cabinet. That's that Jingwei Liao Feng that I was talking about earlier. Paragraph 101 of discussion of cold damage observes that, quote within a quote, for cold damage or wind attack, when there is a Xiao Chai Hu Tang presentation, if there is only one sign, then that is it. It is not necessary that they all be present to make the diagnosis. This statement sparked considerable discussion among commentators. Some interpreted it literally to mean that the presence of just one of the signs or symptoms listed in the source text warranted the use of Xiao Chai Hu Tang. Others, however, read it as referring to the presence of just the chief signs, Zhu Sheng, like alternating chills and fever, fullness of the chest and hypochondria, downcast demeanor with lack of appetite or irritability and nausea. They continue on with the discussion of a translation of the late Qing dynasty physician Tang Zhang Hai. So this is relatively modern, the Qing dynasty is relatively late. Tang Zhang Hai analysis of this formula and discussion of blood patterns. And he says, this is an invigorating formula that spreads out the exterior and harmonizes the interior, that lifts the clear upward and directs the turbid downward. The exterior of the human body in this context refers to the pivotal dynamic of the interstices and pores and the nutritive and protective aspects. We've talked about yin and wei qi previously, nutritive and protective aspects. The interior of the human body refers to the substantial supervisory function exerted by the triple burner on the yin and yang organs. Remember, the triple burner is part of this Xiao Yang. He continues, in the interior, the lesser yang governs the triple burner. In the exterior, it governs the interstices and pores. If we are discussing the nature of the lesser yang, we mean the qi of the ministerial fire with its root in the gallbladder. Remember, gallbladder and triple burner are the two big meridians here. If we are discussing its function, we mean the qi of clear yang that resides in the stomach. The formula uses Renshen, Dazhao, and Gansao to develop the patient's stomach qi. It uses the combination of Huangqin and Zhibansha to direct turbid fire downward, and the combination of Chai Hu and Shenjiang to lift up the clear yang, thus harmonizing and facilitating the patient's qi dynamic. How would the interstices and triple burner not also be regulated? Some interesting commentary and insight into this formula. So later in the commentary, Scheid and his team include a list of 6 broad categories of modern diseases this formula has treated. 1, febrile disorders with alternating fever and chills. That's what it's built for, so that's great. And anytime there's an alternating fever and chills, this is a really potentially useful formula. Second category, digestive disorders that present with signs of stagnation or clumping in the liver and gallbladder channels, or where loss of the stomach's downward directing function is accompanied by a wiry pulse. 3, gynecological disorders that match the presentations of heat entering the blood chamber, where signs of blood stasis are accompanied by alternating chills and heat flushes. 4, urogenital disorders where signs of heat or inflammation are accompanied by qi stagnation. 5, miscellaneous disorders with a clear relationship to the lesser yang channels or related patterns such as inflamed lymph glands in the neck or armpits, thyroid enlargement, hypertension, or palpitations. There you go. There's a lot of really interesting modern possibilities right there. And then 6, nervous system and emotional disorders with a lesser yang presentation, including insomnia, anxiety, headache, and nerve pain. So interesting. Those are the 6 broad categories. Chen has a lot of commentary as well, though it's a lot less than Scheid's book. So Chen, because the Xiaoyang stage is unstable and often short and transient, the symptoms listed above may not be clinically present all at the same time. Therefore, as suggested in Shanghan Lung, the discussion of cold-induced disorders, this formula can be applied even if there's only one Xiaoyang symptom present clinically. So they address that quote as well. So that's an important quote for us to remember, only one symptom. All right, so that's commentary. There's a lot of it. Let's move into some modifications. So many modifications of this formula are used to treat a wide variety of conditions, both traditional and modern. Flaws and Wolf, I love this little book. It's called The Successful Chinese Herbalist, and it's a great little book on how to start. If you don't have an extensive herbal pharmacy or you want to get into it, this is a great book for that. And if you've been doing it for a while, I learned a lot from reading this book because it really has some interesting insights into prescribing and things along those lines. So a nice little book and love it. And it discusses this formula as the first formula they commonly use. So one of the things they say actually is that as you get more and more experience, you actually start using fewer and fewer herbal formulas, but then you heavily modify those formulas for each individual. And I thought that was interesting because that was sort of naturally occurring to me. And I thought, oh, I got to get back into the books and learn more formulas. And this kind of like, well, no, maybe you need to look at your modifications more than the actual formula. So this is the first formula they actually talk about in that book, and is probably one of their first formulas that they use in the heavy modifications. They actually list 37 modifications for various conditions and state these are just an example of possible modifications. So obviously I'm not going over all of those on this chat. Chen Chen, in their book, actually lists 29 modifications of this formula, tons of modifications. And what it does is it really makes it very useful for a lot of modern diseases with just a few little tweaks. So modifications are really important. There's just way too many of them. And there's not one that I can say, oh, here's 2 or 3 of them that are super important. It's like they're all can be quite specific. And so I'm just saying there's a lot out there. And so very useful. And let's modify this formula. But it's just too much to put too much into this discussion. So comparisons of this formula, of course, super important formula. There's going to be a lot of comparisons, and each book has quite a few. Comparisons, different comparisons. I've chosen a couple of them here. So given the prominence of this formula is compared with many other formulas, and we'll only touch on a couple here. Probably one of the most common comparisons is with its sister formula, major Bupleurum Decoction, or Da Chai Hu Tang. So this is minor Bupleurum Decoction, or Xiao Chai Hu Tang. And so why would we use that as opposed to major Bupleurum Decoction? Of course, our Western senses are like, well, if it's major, it must be stronger. So why don't we use that more? No. So let's talk about some of the differences here. According to Scheid and his team, both of these formulas treat lesser yang warp disorders. So there you go. However, a Da Chai Hu Tang presentation is characterized by more severe vomiting rather than occasional vomiting or just nausea caused by stronger heat. So stronger symptoms is the major. Thus, the formula contains a much larger dosage, 24 grams versus 9 grams of Shenjiang, or that fresh ginger. Symptomatically, Shenjiang stops nausea and vomiting, while functionally it assists Chai Hu in venting the pathogen to the exterior. A Da Chai Hu Tang presentation must also have symptoms of heat in the yang brightness organ with clumping such as abdominal fullness, focal distension, and pain. So this yang brightness, or yang ming, is another one of the 6 stages. So this is basically what this is saying is there's a little bit of that second of the 6 stages as it's going into the third of the 6 stages. And with yang ming, we call it the 4 bigs. It's a big presentation. You feel big stuff happening, high fever, high thirst, those sort of big thirst, big fever, those sort of things. So it has a little bit of that going on still. So that's Da Chai Hu Tang. Because Xiao Chai Hu Tang contains herbs that harmonize and tonify the spleen and stomach, it can be used when heat has already been purged from the interior, but some heat still remains in the exterior. In these cases, the formula not only effectively vents any lingering pathogen, but also strengthens the qi of the middle burner that has been weakened by the prior purging. So Chen, so that's Da Chai Hu Tang. They also compare it to that formula we've already talked about, Xiao-san, a rambling powder. Again, Xiao-san is a harmonizing formula. It harmonizes the liver and spleen. So it's a little bit different, but it's under that category of harmonizing formula. So it's an interesting comparison here. So here's what Chen says about these 2 formulas. Xiao Chai Hu Tang treats alternating chills and fever caused by exterior pathogenic factors that enter the Xiaoyang level and get trapped in the half exterior and half interior location. Renshen, Dazao, and Gansao strengthen the interior to push the pathogens outward and prevent them from invading further into the body, not to tonify the deficiencies. Shenjiang is used with Bansha to treat nausea and irritability caused by gallbladder heat invading the stomach. Xiao-san treats alternating fever and chills caused by disharmony among the liver, spleen, and gallbladder, and accompanied by blood deficiency and liver qi stagnation. The chills and fever are not the result of an exterior invasion. So if it's an exterior invasion, Xiao Chai Hu Tang. If it's not exterior, then you can think about Xiao-san. Dongui, Fuling, and Baiju strengthen the spleen to prevent the liver from overacting. Shenjiang warms the middle jiao to strengthen the spleen. All right, so there's a couple comparisons. Like I said, there's a lot more out there, but I think these are 2 big ones. Let's step into biomedical indications for this formula. And this formula is used for several biomedical conditions. Scheid talks about 4 groups of biomedical conditions. And here they are. 1, those manifesting with chest and hypochondriac pain, including hepatitis, chronic cholecystitis or gallbladder inflammation, chronic gastritis, peptic ulcer disease, acute pancreatitis or inflammation of the pancreas, pneumonia, and pleurisy. So pleurisy is inflammation of the pleural spaces in the lungs. It can be quite painful. The second grouping here is acute febrile illness, such as upper respiratory tract infections, tonsillitis, conjunctivitis, that's the conjunctiva of the eyes, malaria, typhoid fever of unknown origin, perimenstrual fevers, and postpartum fevers. Third, those marked by periodicity, which is things come and go, such as bronchial asthma, epilepsy, angina pectoris, that's angina pectoris is chest pains, allergic rhinitis or allergic runny nose, and premenstrual syndrome. And finally, the fourth grouping is those affecting the pathways of the lesser yang channel, such as migraine, intercostal neuralgia, so that's nerve pain in between the ribs, perioral eczema, so that's eczema around the ear, I think, oral, yeah. Parotiditis, that's inflammation of the parotid glands. Suppurative otitis media, so that's a middle ear infection that's suppurative, that has drainage. And mastitis, so that is inflammation of the nipples. So that's from Scheid and his team. Chen also includes several pharmacological effects of this formula, including it is hepatoprotective, it helps the liver, cholagogic, it helps secretions from the gallbladder, immunostimulant, it helps the immune system, anti-inflammatory, temperature regulation, regulates temperature, gastrointestinal, helps gastrointestinal issues, anti-dyslipidemic, so it helps hypercholesterolemia, so too much cholesterol or lipids in the blood, anti-allergic, anti-ulcer, anti-tumor, and radioprotective, so if you have to have radiotherapy for some reason, usually a tumor or cancer or something along those lines, this can be helpful for protecting against that. Some Chinese studies, as reported by Chen and Chen, report showing benefit in the following conditions. You can see on here, I have numbers of patients. And in general, there's some of these are a little bit small, but several of them are relatively large, but they are Chinese in origin. And when you look at the results, they're not, these are a little bit older, so they're not exactly up to modern standards. So, but just to give you an idea of some of this: cough, chronic hepatitis, viral hepatitis, hepatocellular carcinomas, that's liver cancer, cholecystitis, so that is gallbladder inflammation, usually implies gallstones, pancreatitis, bronchial asthma, morning sickness, a lot. The number there is 320. That's a lot of people in morning sickness, so useful for morning sickness. And dysmenorrhea, so that's painful menses. So they also list another 26 studies of a whole bunch of different types of conditions using various modifications of Xiao Chai Hu Tang. So the ones that I just talked about, they imply that it's just the straight formula of Xiao Chai Hu Tang, and then all these other studies with various modifications. I didn't want to get into them because it's hard to say, well, it helps XYZ, but only if you add in these herbs, and it devolves into a lot of slides, and I didn't want to get into all that. But as far as formulas go, this is a very well-studied formula. Talk about drug-herb interactions. So Gonzal may increase blood pressure. That's licorice, Huangqin, or Scutellaria. So we have a bunch of potential interactions with cytochrome P450. Again, I don't want to get into it, but it is one of the major markers for drug-herb interactions. If you want to know more about it, do that drug-herb interaction series that I was talking about. We definitely get into that in the second webinar in that series. But Huangqin inhibits several of the cytochrome P450s, as does Renshen. Renshen may also interfere with warfarin, digoxin, and raltegravir, which is an antiviral. And then Shejiang also has some cytochrome P450 interactions and potentially interferes with anticoagulants as well. So generally, we want to be a little bit extra cautious when adding herbs in with anticoagulatives. So warfarin is the major one that we're worried about, which inherently has its own issues. So we don't want to add herbs into the mix of it. All right, so let's drug-herb interactions. Let's talk about some of the concerns, then we'll wrap this all up. So Scheid and his team say this formula promotes the spreading out of yang qi, which can cause headache, dizziness, and bleeding of the gums if taken long-term. This is not a long-term formula. These side effects can be reduced or eliminated if the formula is prepared according to the directions in the source text. For the same reason, unless considerably modified, it is contraindicated in patients with excess above and deficiency below, liver fire, or bleeding of the gums. Used with caution in cases of ascendant liver yang, hypertension, or vomiting of blood due to yin deficiency. Patients with relatively weak normal qi may experience fever and chills while taking this formula because the pathogenic influence is vented from the lesser yang warp via the greater yang. Chen has its own concerns, echo some of these concerns. Xiao Chai Hu Tang should be used with caution in patients with yin and or blood deficiencies, in patients with upper excess and lower deficiency, or in patients with liver fire. Inappropriate use of this formula may result in headache, dizziness, or bleeding gums. In general, there is no sweating associated with relief of symptoms following the administration of Xiao Chai Hu Tang, since it harmonizes rather than releases the exterior. However, some patients do show sweating prior to recovery. These should be monitored closely to prevent excessive sweating from injuring yin. Avoid cold, raw, pungent, spicy, and spicy foods, pungent and spicy foods while taking this formula. That was it. We got through it. There was a lot. So in summary, that was today's formula, Xiao Chai Hu Tang, a very important, useful, and interesting formula. We started by finishing up our discussion of Pao Zhi, or processing, and then we got into the formula, including its ingredients, commentary, lots of commentary, the science, our concerns and cautions, as well as its potential drug interactions. All in all, another exploration of an interesting Chinese formula, in this case, a very important formula used for a wide variety of conditions. And the reason why it's used in a wide variety of conditions, I said it's used in a lot of modern diseases. A lot of modern diseases kind of present themselves with a pathogen that kind of got stuck, not in the exterior, but not quite in the interior. You think about things like Lyme disease is one of those things that we have what are known as hidden pathogens in Chinese medicine that are they're hiding it. This is a great formula for those. And those are considered to be sort of more modern diseases. A lot of modern diseases may be considered that. So this is a great formula for stuff that's lodged but not moving out. And so, a lot of our modern diseases fall into that. So that's why this is so useful for that. All right. Next episode, in 2 weeks, we are going to be looking at one of the big daddy herbs, an OG, absolutely one of the most commonly used and important herbs around, and used in today's formula, Renshen or ginseng. Really, this herb cannot be oversold. I'm going to say, this is the reason why we sell herbs in the United States. I mentioned this earlier in one of our Sperb herbs when I talked about F. Molly versus Heckler, which was a court case, and it involved the sale of ginseng among other herbs. Ginseng was one of the first herbs that was brought in to the United States to be sold over the counter. And it was that lawsuit that basically gives us the right to sell herbs, at least in the United States. So Renshen is it. This is the original, the OG. So, and as always, we will be looking at something a little different. So please join us in 2 weeks for another crucial and absolutely foundational episode. Thank you very much. I appreciate you listening to all this. If you like this podcast, please do us a huge favor. Give us a 5-star rating in your favorite podcast app. We're on all the podcast apps. If we're not on one that you use, please let me know. I'll get us on there. But man, we would be so appreciative if you were to give us a 5-star rating. That would just be amazing. And remember, you can get this and 30% off our Drug Herb Series CUs and NCCN PDAs at www.integrativemedicinecouncil.org. That's council, COUNCIL.org. And if you want that 30% off, just put a /32 at the end of that, and you'll see that 30% off. You can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.sperbsherbs.com. As always, I'm Dr. Greg Sperber, and I really appreciate you hanging out there. And again, a big, huge thank you. And of course, as usual, I have a very extensive bibliography on today. Lots of stuff.
Sperb Herbs.
The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Thompson.
Dobbins.
John
Rogers.
Campbell.